Good afternoon.
Good afternoon. I am Dr. Joanna Harvey. I am a chartered counselling psychologist.
Mum rage, when you see the word, a lot of people preconceive it as she's kicking off, and it has such negative connotations.
I think if you ask any mum, have they experienced really intense anger since having a baby? Nearly all of them would say yes. There's huge societal pressure and demand on women to do everything, to be everything.
I feel bad because I wanted this, so why am I then angry?
Philippa Perry, the psychotherapist, she talks about actually just going and screaming into a pillow because those feelings are there and you just kind of want to get them out.
I think there's such a worry that people are going to judge your parenting or your capacity as a mother.
Motherhood just isn't like the Pampers adverts. It's full of lots of challenges, interspersed with those happy moments.
I got so scared because I was like, why am I not feeling what I should be feeling? And actually there is no right and wrong.
From the moment of birth, you have this traumatic ending to a birth and you have this amazing beginning of life. And they're side by side. You can still be grateful to be pregnant, but it's actually just really crap to be feeling sick all the time.
How are we going to know whether this is beyond normal worries and this may be considered postpartum anxiety?
Most people are thinking, well, what? Leave, they let me go home. I don't know what to do. I was terrified.
How can we manage this on our own at home?
The things that you need to be looking for are, so there is something called tocophobia, which is a phobia of birth.
How the hell are we going to communicate it, especially if we don't even know whether it's just general motherhood?
But anxiety and depression can really coexist as well.
If you can only give 50% today, then you're still giving 100% of yourself. Good afternoon.
Hello, good afternoon.
So you just go ahead and let everybody know who you are and what you do, and then we'll get cracking on the questions.
I am Dr. Joanna Harvey. I am a chartered counselling psychologist and I specialise in postpartum mental health.
Well, I'm really excited to talk to you today because I do think there's so much stuff on social media about maternal mental health. And it's really hard to know, is this just something that is becoming a trend? Is it a real thing? Like mum rage, when you see the word, you just think, I think a lot of people preconceive it as she's angry, she's kicking off, and it has such negative connotations. And someone's written in here that they feel like the most awful mum. And is it even a real thing? And I feel where she's coming from, because it is so easy to just, when you're overstimulated, to just like bite back and say things and you go, oh my goodness, that wasn't even me.
Sure. I mean, I would definitely say that it is not a trend. And I think if you ask any mum, have they experienced really intense anger since having a baby? I think nearly all of them would say yes. Like there is research that actually demonstrates a really high number of mums do feel this intense anger, which is a different anger to anger they might have felt before having the baby.
Yeah.
So yeah, I would say it's very much a real thing. I think it is a hot topic at the moment because the more that we talk about it, the less shame people feel around it and the less isolated they feel. So I think there's probably a level of people recognizing that actually I'm not alone in feeling like this. It feels really awful and I feel terrible afterwards. But actually, I'm not the only one who feels like this.
And do you think there's a reason for it? Do you think it's just hormones, or do you think it's in terms of, we put on a lot of pressure on ourselves to do everything, and for whatever reason, even if we have the most loving, supportive partner, it's really easy to go, no, it's fine, I'll do it. And or is it a case of that, you know, sometimes we feel like our partner isn't quite connecting with what we need?
I think it's probably all of these things. I mean, mum rage, I actually don't love the phrase mum rage in and of itself, because I think it kind of makes it a bit like cutesy, and it's not a cutesy feeling, and the reasons that underpin it aren't cutesy either. Yeah. I think it's really multi-layered. I think hormones do play a role, but it's definitely not just hormones. And I think historically that's really been used to dismiss women. You know, it's just your hormones, you're crazy, you're angry, which is really belittling and doesn't incorporate the whole picture at all. So they do play a factor, but they're not the whole picture. I think we all know that, exactly as you said, there's huge societal pressure and demand on women to do everything, to be everything. And the rage is really like the pressure cooker that just spills over. You know, you're digesting someone else's emotions day in, day out when you have a baby and then the toddler and feelings get even bigger. You're constantly doing that. And then there's all of the practicalities around caring for children that come with that. You might be trying to work alongside it. Maybe you've got other children. You've got a huge amount of expectation on yourself. And I think the rage is really, it's that manifestation of just like complete overwhelm, actually.
Yeah.
And then when we look below the anger, there's so much else going on. It's a really common difficulty in couple relationships as well. I think it's very often the case that the partner doesn't really understand why the mum is so angry. And usually that lack of understanding is because they're not really in their shoes, you know, day in, day out, being the primary caregiver, thinking of all of the other things that are included in having a baby and having small children. And there's often a mismatch. One of the really difficult things about anger, I think, is that none of us really know what to do with it. So actually, if the mother does have this episode of kind of really losing it, actually, it's quite hard for the other person to come in and say, you know, I really see what you're feeling now. I know that you're really angry. Is there anything else that's going on? You know, most people's partners aren't the therapist as well. So the natural reaction is this kind of either fight, flight or fight. And then it creates a row between the two of you.
And I think a lot of, in general, I think we all feel like anger is a bad emotion to have, when in actual fact, actually, it's actually really healthy to be like, you're feeling that feeling, but understanding why. And in the moment, you definitely don't understand why. It's just like it takes over.
Yeah, it does take over. It's a really intense experience. We feel it viscerally, that kind of anger, which is often why it's accompanied with losing control. You know, when we talk about mum rage, we're not talking about, oh, I'm really annoyed. You know, you're talking about people throwing a book at the wall, or, you know, going outside the garden to scream because it feels that intense. And I think it really does feel that intense for a lot of people. And to your point about kind of feeling sort of ashamed or bad about it, I think a lot of us grow up not really knowing what to do with anger because it's not been tolerated within us. If that was modeled to you that actually angry is it's just anger is a healthy emotion and that you can express that safely without negative repercussions or ramifications, you know what to do with anger. But most people actually didn't receive that. So anger is something that has been buried or repressed or just really kept inside. And then when you become a mum and you have so many pressures and so many demands on you, and your child unwittingly reignites those feelings within you, it all comes spilling out. And I think it's not that you weren't angry before. That anger was always there. You just weren't in touch with it. And then when you have a baby and it suddenly springs up out of nowhere, it feels really overwhelming and it feels very shameful because it's not something that you're used to dealing with before.
Yeah. And also you think kind of, I know a lot of people, they've been wanting a child for so long, and then you almost feel like, oh God, why am I even angry? I feel bad because I wanted this. So why am I then angry in whatever situation it is? And I think managing that and knowing what to do. I mean, sometimes someone put here, I'm so stressed and burnt out. I don't think a bath is going to fix it, because you do see so many people going, have some self-care, do your skincare, have a bath. And although that's great, when it does come to especially anger, it's like, well, a bath doesn't fix it in the moment in terms of managing it. And is there a way that we can, as mums, go, okay, so sometimes we just have to accept the fact it's going to come, and sometimes you can't manage it, but are there ways to go, okay, but when the moment's passed, or if I feel that coming, is there something that I can do?
Yes, I think so. I think that's a really good point, that actually, you know, this anger is going to come. I think maybe it's unrealistic to think, well, you know, I can just do a few tools and techniques or have a bath and I'll never feel angry, and then I really will be the good and perfect mother. You know, children do kind of push you to your limits, and you don't have to act out that anger in aggressive or dangerous ways, but equally we can accept having it. I find that it can be really helpful to name the feeling. So actually just kind of talk aloud to yourself, you know, I feel really angry right now. I feel really frustrated right now. I think there's something about actually naming the feeling that you have that immediately starts to kind of acknowledge it and help it reduce a little bit. I think I don't know if you've ever read it, but Philippa Perry, the psychotherapist who wrote the book You Wish Your Parents Had Read, she talks about actually just going and screaming into a pillow because those feelings are there and you just kind of want to get them out. She's not talking about, well, you shouldn't feel like that, or here's what you can do to get rid of that feeling. It's about actually how can you manage that feeling in the moment.
Yeah. Yeah. And I think there's such a worry of being judged and worry that people are going to judge your parenting or your capacity as a mother. I mean, someone says here they're worried, they don't want to reach out because they're worried they have postpartum depression and they're worried about being judged and they feel so guilty because all they've ever wanted is a child. So why should they feel so low?
Yeah, I mean, there's so much guilt involved in motherhood for so many mums, and the reality is that motherhood is a constant conflict and juxtaposition of feelings. You know, it is both. You can desperately want to be a mum, yearn for having a child, have the baby, be grateful for the baby, love your baby immeasurably, and also feel low, angry, anxious. Both of these things are true. You know, one doesn't cancel out the other. And I think, you know, when people's mood is really low as well, part of that is a lot of self-blame and often a lot of anxiety about what other people are thinking. So I think it's really, really important if you are in that position to try and talk to other people. You know, maybe that's a therapist, but actually maybe it's just other mums or a friend or people who might have been in a similar position, to know that actually lots of people do feel like this, and it definitely doesn't make you a bad mum. You know, motherhood just isn't like the Pampers adverts. It isn't full of lovely moments and feeling happy every day. It's full of lots of challenges all the time, interspersed with those happy moments as well, right? It is both, and it is always both. I think, you know, the question that came in from one of your followers about, you know, I feel bad because I've always wanted a child. There's so much expectation that comes with that as well, perhaps without even realizing this like idealized view of what having a baby will be and what motherhood will be. And especially if you're someone who's not had previous experience of babies, maybe your friends haven't had many, or you aren't from a big family, it can kind of feel like, why did no one tell me it was going to be like this? You know, I thought it was all cute outfits and cuddles and snuggles in the nursery before bedtime, and it's just not like that. You have those moments too. It's not that they don't exist, but it just isn't the full picture.
Yeah, because I think especially on social media, I mean, I'm guilty of it. A lot of us just post the good times. We post the good side of motherhood or the days out. And I think if you haven't had a child before, you see that and you think, well, that's the epitome of what motherhood's going to be like. And, you know, you see these videos and you see films where they're given birth, the baby's placed on their chest and they're elated and everything's perfect and they've had the perfect birth. And in actual fact, I remember I was definitely elated and I was overwhelmed and I was like, oh my God, I love him so much. So all the feelings that you do see. And then in the late evening, it was just, I felt absolutely nothing. I was like, and I got so scared because I was like, I'm looking at this baby and I was completely overwhelmed and in love with him. And then I looked at him in the evening and I was like, I'm not feeling any emotion at the moment. And yes, it was a bit of a traumatic ending to my birth. But I was like, oh my God, I feel awful. Why am I not feeling what I should be feeling? And actually, there is no right and wrong. And I do think, like you said, reaching out to even mums and realizing that what you're feeling, no matter how crazy you think it is, everybody has felt it at some point, or one mum has felt it at some point.
Yeah, I think that's absolutely true. And it's also interesting that you said there, you know, I kind of had a traumatic ending to the birth. So, and then why wasn't I feeling great? You know, this right there from the moment of birth, that you have the two conflicting things. You have this traumatic ending to a birth and you have this amazing beginning of life, and they're side by side. So in many ways, it's a completely understandable and natural response to also have those conflicting feelings of, you know, that huge rush of love for your baby and this is amazing, and then also a kind of like a almost like a come down from it, you know, like now I just don't really feel anything, because it's so much for your brain to take in.
Yeah, I mean, someone says here that they're not having the best pregnancy. They're feeling sick, they're in pain all the time, and they feel really low. and they're worried that this feeling won't lift once they have given birth.
Yeah, I mean, I will share from personal experience. So I have twins, and I had hyperemesis in that twin pregnancy, which is like a severe form of morning sickness. I also have had morning sickness in another pregnancy, by the way, and it was definitely not the morning. It was round the clock. I don't know
Why
why
do they
it's
call
called
it morning
morning sickness.
sickness?
And it is really miserable, feeling really sick and nauseous the whole time. And I think that it's really understandable that you don't feel that perky and in a great mood. You can still be grateful to be pregnant. You can still look forward to having your baby, but it's actually just really crap to be feeling sick all the time.
Yeah.
And, my experience of having really bad sickness, I was lucky that mine actually lifted at 20 weeks, but there was a couple of months when I couldn't really do anything. And it does really lower your mood because you can't really think about anything else. It's so hard to take your mind off it. So I think, cut yourself some slack. Like it's not a joyful experience feeling sick all the time. Quite frankly, it's horrible. And it will lift when you have the baby. The sickness does just go like instantaneously. You hear stories of women who've been hospitalized multiple times in their pregnancies because of hyperemesis, and the moment they deliver the baby, it's like semi euphoric because the sickness just lifts. And
It's mad, isn't it?
Yeah, it's crazy. And I think it's really hard to unpick those things, like what part of that is low mood around other things that you're feeling, and how much of that is actually, there's an objective reality to this. Like you're really physically struggling, you feel sick and rubbish all the time. Like it's hard to be in a good mood when you feel like that.
Yeah, and I think someone's put here, the wait lists are just ridiculously long for getting any help, especially postpartum for your mental health. And is there anything that you would recommend that we can all do at home? If we get the luxury of being able to talk to someone, great. But is there anything that we can do while they are on these long waiting lists that we can do to kind of, someone wrote into you, didn't they, that how can we harness these highs and lows as a superpower, and how can we manage this on our own at home?
Yeah. So I think it is a sad reality that the provision of perinatal mental health services is quite poor in this country, and it's hugely dependent on like where you live. Some areas have much better ones than others. I think the Maternal Mental Health Alliance even did this map that showed where there are kind of up and running perinatal services and huge gaps where there aren't. So I understand it's really difficult for lots of people to get the help that they need, and therapy, individual private therapy, is really expensive. I would always really suggest, in terms of things you can do at home, it's less about what you're doing at home and more about what you can seek out in your community. I think a really significant element of a lot of maternal mental health struggles are really exacerbated by people's sense of isolation, in terms of thinking that they're the only one who feels like this, and also literally being isolated. It's really lonely being at home on your own with a baby all day. And the more that you can get out and about and try and meet other mums. I know that's really hard. Like when you're in a bad space and you're feeling really vulnerable and you're feeling low, you usually don't think, oh, I'm going to go and meet a bunch of new pals. But actually, community and connection is so important in terms of protecting your mental health, and being able to see other people's struggles as well, that, you're not a bad mum and you aren't the only person who feels like this. Not everyone else is finding it easy and like having a wonderful time at Baby Sing and Sign or whatever it might be. It does take a little bit of kind of being proactive and finding out what's around there and what's on in your local area. I know where I live, there's quite a lot of kind of drop-in community groups that they're quite informal spaces. They're just going to like have a drink and have a chat with other mums. So I would really suggest trying to do something like that.
There can be a lot of anxiety, I think, coming with that as well, can't there? And I think someone's here, how do I know if it's not just normal mum worries? Like, obviously, when we first give birth, the anxiety of taking your baby out on your own for the first time, that's very normal in terms of just, of course, it's going to be anxiety inducing, of course. And, have I put him in the car seat properly? Or have I got everything in the bag that I need? Of course, that's normal. But it's, how are we going to know whether this is something that this is beyond normal worries, and this may be considered postpartum anxiety? Because I know for sure that I didn't know that I had it until I came out of it. I still have elements of anxiety, of course, and I was quite an anxious person before I gave birth. But now he's a bit older, and I'm much more relaxed about things, and you kind of get into your stride a bit. And I look back and I go, that was definitely postpartum anxiety without a doubt, because it was too much. It was to the point where even I couldn't control it. And, and it's, how are we going to know whether it is something that we need to get help with, or, okay, this is just normal motherhood?
Yeah, that's such a good question, because I think, there's a lot of things that mums are just expected to get on with that actually are really distressing and debilitating. And just because it's kind of part and parcel of the whole picture doesn't mean that you just have to accept it. You're right in that I think most new mums are anxious to a degree. Very few people, I know that it happens to some, but very few people take a baby home and think, well, I know exactly what I'm doing. Most people are thinking, well, what now? I can't believe they let me go home. I don't know what to do. I remember taking my son for a walk in the pram on my own for the first time, like without my husband. And I was terrified. I don't know what I was terrified of, but I was gripping that pram, like we're out in the world, and you feel so vulnerable, like you've kind of got no skin on, and, just sort of baby, and they're so tiny, and you don't know what to do if they cry, or what do I have, what if I need to change his nappy outside, or whatever it might be. So I think there is a certain, you can expect to feel a bit nervous and worried. You've not done this before. It's completely new. And look, it's a huge responsibility when you bring a baby home, and it can be really overwhelming. I think when does it start to tip into something more challenging, and when does it become less about worries and more about actual, postpartum anxiety? And I would say the things that you need to be looking for are, how much space is this taking up in your mind? Are you having the occasional passing thoughts about things that are worrying, or do you actually feel that the majority of your thinking is taken up with worrying about the baby? Because if it's the latter, and you feel that actually your thinking is really dominated by these anxieties and worries, then I would say it's worth reaching out for some support. Go and see your GP, chat to your community midwife, and if in doubt, speak to somebody. I think don't just kind of battle on alone. I think also, if you find yourself making a lot of adjustments in your life to manage the anxiety around the baby, that's another red flag that actually this is probably not just a few worries, and that you really are struggling with this a bit. So that might be avoiding going to the house, not meeting up with friends, having lots of kind of catastrophic and intrusive thoughts about things that might be happening to the baby. Those kind of things, I would say, that's not just a passing worry. That's something which is clearly causing you quite a lot of distress, which is another key marker, really. If you have a lot of little worries throughout the day, but you're not that bothered by them, then you're probably managing that. But actually, if you're really distressed by these thoughts, they're really bothering you, then that tends to be a sign that there might be something more serious going on for you.
And for someone that hasn't had any anxiety before and it's new to them, are there physical symptoms that we may get? Or is it all just kind of mental and noticing those signs?
No, there's lots and lots of physical manifestations of anxiety, because anxiety is really, it's our body's fight or flight response. So it's like our body's internal car alarm going off. And when you're struggling with an anxiety disorder, it's like that has kind of gone a bit haywire, because your body is scanning and interpreting for threat all the time, and it responds physically. So there are things like, butterflies in your tummy, maybe feeling sick, finding that your heart rate has increased a bit. Some people report feeling kind of clammy and sweaty, headaches, muscle tension and aches as well. All of these things can be symptoms of anxiety.
Wow. And someone says here that they're a first-time mum. They haven't given birth yet, but the pregnancy and the labour is just making them so anxious. Because obviously going into labour, you don't know what it's going to be like, and it's different for everybody. Is there a way that she can kind of calm herself down and I guess not get control of the anxiety, but know that trying to make peace with the fact that labour and pregnancy is just, you really do have to just go with it?
Yes, which I think is why it causes so many people so much anxiety, right? Because it is really out of your control in many ways. And you can do as
Mm.
much birth prep as you like, but that doesn't mean that you will always have the birth you want. I mean, so there's a couple of things that I would be thinking there. So again, how distressing is this anxiety? So there is actually something called tocophobia, which is a phobia of birth, and perinatal mental health services are quite used to dealing with that, and will see women when they're pregnant to help them manage the fear around that. That's at the more kind of like severe end of the spectrum. Lots and lots of people have like worries and anxieties about birth. I would, and I'm not a birth expert by any means, so this is really just probably like my unprofessional opinion. I would recommend doing hypnobirthing for the calming technique. So I actually have had all of my babies by cesarean section for various reasons, but I still did all of my hypnobirthing. And when I initially did it, I didn't know I was going to have a cesarean, but it meant that I went into labor. Tell you a story another day, but I did go into natural labor anyway. And it meant that I wasn't afraid, because I actually felt that I had informed myself and I had educated myself, which is largely what hypnobirthing is. I think there is a bit of a misconception that it's just about lighting candles and having this amazing birth in a pool, which I do think sounds great. And I think most of us would love to have that, but so many of us don't have that for various reasons. But it isn't just about that. It's a kind of education process, really, to teach you about the physiology of birth. And then, although you might not be able to control the outcome, you can have an understanding about actually what's happening to your body. Like, what are the stages of labor? What might you be able to expect in these stages? Because I think then you're armed with the information. It seems less frightening and less completely out of your control. And the breathing techniques are really helpful, I think, for your anxiety. In fact, I still use them now in other anxiety-inducing situations in life, not just having a baby. So I would have a look at doing stuff like that, and also asking yourself, like, what is it that's worrying you about this? Is it because you think something bad is going to happen? Is it because you can't control it? What are the elements of that are really bothering you? And what might you be able to do about that? And also share them with your midwives. You know, you should have relatively regular appointments with your community midwives. And some of them are really great and really reassuring. I think don't sit there fretting on your own about it. Share your concerns with other people. Let your partner know, if you have a partner, that this is what you're worrying about. Tell the midwife, speak to a friend who maybe has had a baby.
Yeah, because when I did hypnobirthing in the last part of my labour, I wasn't in a position where I could make decisions, basically. And because I'd done hypnobirthing course with my partner, and I can't remember what it's called, but when you're given an option and you, rather than just going, oh yeah, it's fine, go ahead, and just letting the doctors get on with it, knowing you have a choice, although the situation is out of your control, you are in control with how you then proceed. And to be able to turn to my partner and just know that he knew exactly what to do, not because he knew anything about birth in terms of, we know stuff about birth from hypnobirthing, but we're not professionals, but that he knew that we had a choice and we'd made those decisions before we went in. So if, for instance, I'd love a birth in a large pool with some candles and some cool music, it's not going to happen all the time, but knowing, okay, so when we're given these decisions, which one can I choose? So you still feel in control with the decisions that you have to make. And I think that really, really helped us. But someone's written here, they put, they don't know if they're struggling with anxiety or depression. They can't distinguish the difference. But then they also don't know how to communicate that to their partner. Because I think as mums, our lives change dramatically when we give birth. Yes, they change for the partner, but in terms of we're dealing with all the hormones and we're dealing with the birth and we're dealing with so much more, that sometimes it is really hard to communicate to your partner how it feels, because they're on the other end of it. And they can feel completely, the same in terms of that, I don't know what to do to help. But how the hell are we going to communicate it, especially if we don't even know whether it's anxiety, depression, or just general motherhood,
Yeah, and although it can be helpful to have diagnosis in terms of like getting certain medications or certain kinds of treatment, actually that doesn't really matter so much in that it's an overall experience, right? As you said, just like, is this kind of huge, overwhelming transition to becoming a mum that actually no one can really prepare you for. I know we say like, oh, no one told me it would be like this, but we're also not really listening, I think, before we have a baby. So, debatable about if people did tell you whether you would, well, maybe you wouldn't have one. I don't know.
Yeah.
It's all abstract until you have the baby, I think.
Yeah.
The good bit as well as the bad. But anxiety and depression can really coexist as well. You don't have to be like you have one or you have the other.
Yeah.
I think talking to your partner is something that is different for every individual couple, people's communication styles, what they were used to talking about before, how receptive your partner is or isn't. Something that I do see quite a lot is people often say, well, they wouldn't understand. So like, there's no point in me saying anything.
Yes.
And yes, they might not fully understand and they might not respond in the way that you hope that they will. You need to give people the opportunity to at least try and understand.
Yeah. Because we're not mind readers.
Yeah, exactly. Other people aren't mind readers. So, you've got to be honest with yourself as well. Like, it's a difficult conversation to broach, but actually, can you have the courage to broach it? Can you say, I'm not really all right? Like, I don't really feel okay. And you don't have to put it together in this really coherent way, like, you're explaining something. I think you could just say, like, I'm if you don't know where to start, you can just say, I'm struggling. I'm not okay.
And that is the hardest step.
Yes. Yeah, exactly. Especially if, as you were saying before, especially if people are putting all this pressure on themselves. Like, I always wanted a baby. Why do I feel like this? Or maybe somebody had quite a long fertility journey and struggles in conceiving. That can be a real area in which people feel really bad about not loving every minute. But actually, not every minute is lovable at the end of the day. And that's okay.
Yeah. And I think also we all get that kind of 4 days postpartum where we kind of have this massive hormone drop.
Yeah.
And you just feel really low and you're crying endlessly. And someone's here to put, what's a normal reaction to such a huge change in your life? And hang on, this is hanging around a bit longer than I was thinking it was going to be.
So, yeah, I mean, lots of people get what we think of as like the baby blues, which is that big hormone drop. I know I had it with all of my children. I just like cry at anything, drop a hat. I do remember seeing my husband's slippers by the fireplace and I cried because I was like, oh, what would I do if he wasn't here?
But it's so real.
Yeah. You just kind of cry at anything. I think it's that but it's the hormones, but it is also that like you feel so vulnerable when you've just had a baby, like the baby is vulnerable, but you're really vulnerable too. But with the baby blues, it's a temporary thing and it should really be shifting after a week. If you find that that's dragging on and you're still really, really tearful and really low and it's going on for kind of 2 weeks or more, then I think that you would need to be calling your community midwives or your GP and seeking some support around that, because that rather indicates that it's not just the hormone drop and it could be something else. But again, as your original question said, the transition to motherhood is massive and you are on this real emotional roller coaster. And I think that there's a lot of fear for a lot of people around postnatal depression. Like, am I going to get it? Is it going to be me? I think it's a really common fear that people have in pregnancy, and people who have had postnatal depression, when they are pregnant again, they often worry that they're going to have it for a second time round, which isn't always the case because you've often learned different skills and you know how to manage in a different way. So I think, there are ups and downs, but postnatal depression is a more distinct difficulty, which is usually accompanied by your mood isn't shifting that much, like it's consistently low. And also it's often accompanied with lots of self-criticism and self-blaming thoughts around not being a good enough mother, not deserving of the baby. Really, really distressing thoughts can accompany that. And I would say, again, all of those things are signs that that's not just, your hormonal ups and downs and being on an emotional roller coaster. That might be more leaning towards postnatal depression. and struggling to bond with the baby as well.
Yeah, because you don't know how you're going to feel after birth. I think so many people are worried about being judged with their emotions surrounding in motherhood in general. And I think then we pile this pressure on to be the most perfect parent. And what that looks like in everybody's eyes is completely different, whether that's, no processed foods or no screen time or whatever. But for one mum, it might work and it's wonderful. And for another mum, something else works. And I think that today as a society, there's almost too much information out there for the best thing for your kid, for the development of your kid, or for what you should be doing as a mum, that it gets to the point where you're like, fuck's sake, like, I don't know where to even begin. And then you start just feeling like you aren't a good enough mum, when in actual fact, just showing up for your child every day, because before giving birth, you had a shit day, you'd be like, oh, well, I'll just prioritize myself. But now, if you feel ill, you got to get up, you got to parent. If you're not having a good mental health day, you got to get up, you've got to parent. And in actual fact, whatever happens in that day, whether it is an entire day of screen time or whatever you think isn't great for your child, if you've got up and you've shown up for your child, to me, I think that's the most, you've got to give yourself the most praise for just showing up.
Yeah, absolutely. And that is enough. And so on the days when you're really struggling, that's more than enough. I think I agree with you, that there is like so much kind of pressure and expectation and all these sort of perfect parent, do it this way, do it that way, that your child ultimately is not a project for you to perfect. They actually just need you to be there and be present enough. You don't have to be, present 100% of the time. You've still got to get other things done. And as you say, like, parenting is really hard. There's no time off. There's no break or holiday from it. It is an amazing joy, but also relentless at the same time, and will push you to your limits. And I think that it sounds a bit trite, but you do have to be kind to yourself in that respect.
Yeah. And I saw a brilliant quote. I can't remember the exact quote, but it was to the effect of, if you can only give 50% today, then you're still giving 100% of yourself. You're not giving a lesser percentage. You're still giving everything that you have. And I think that whether you're going through anxiety, depression, or mum rage, it's something that I think getting help for or reaching out is more important than beating yourself up for what you're feeling, because there's no right or wrong.
Yeah. And so many mums look at the things that they didn't do and not all of the things that they have done. Even on that bad day when you felt rubbish and you were ill, you probably still got your kids up, got them dressed, fed your baby, entertained them. You're still, even when you're doing the minimum, it's still a lot, right? And rather than
absolutely
giving yourself a hard time for, I don't know, putting a cartoon on for a bit or giving them some food from a pouch rather than something that you've made yourself, you kind of have to cut yourself some slack. And I do think with that although there is lots of societal pressure and expectation, the only person who can change that is you. Society is not going to turn around and say anything different. So you have to be the mother for yourself to be like, it's okay, that was good enough and enough, and that's fine.
Yeah. Well, listen, thank you so much for coming on today. It's been mind-blowing, some of the stuff that you've talked about, and just kind of putting it in front when you're dealing with stuff that you're struggling with, and then when someone says it and you just feel, you're like, why can't I make sense of that at the time? And you've just kind of made it all simplified, and it just makes so much more sense and so much easier to understand how to move forward, which has been lovely. But I also want to give you the opportunity now to just kind of tell people where they can find you and what help you can give them.
So I am on Instagram at Dr. Joanna Psych. I've got some underscores in that and I can't actually remember where they are. So
I can put it all in the description below.
So you can find me there, Dr. Joanna Psych. So I offer lots of kind of information and educational bits on perinatal psychology and perinatal mental health over there. And I also see women for one-to-one individual therapy. And in the future, I will be pulling together some courses to make that more accessible. Thank you so much for having me on this. It's been really great to chat, Roy.
Oh, it's been wonderful. And I really hope that it reaches out to any mums that are struggling and just want a bit of reassurance that it'll be okay.
Thank you so much.